Dr. Osmonov is one of the main professors of the University of Kiel. For the past 10 years, he worked relentlessly to make his field better than before.
It's a new office. Those are representing the house made a house, and now he has to.
So we are here in Kiel, and the subject I want to talk today is about why you are doing the cadaver lab, the way you are doing now. How long has it been?
So first of all, thank you very much for coming. Actually, Kiel is the end of the world, and I want just short to tell you a very funny story. Dr. Wilson asked me, "Where's the Kiel? It's in the middle of nowhere." But now, after 10 years and so many years we are doing these labs, we are in the Center of Prosthetic Urology doing cadaver labs. The reason for that, I think, the surgeons learning anatomy only in the medical school. And, well, they have knowledge, basic knowledge in anatomy, but it's basic for the surgeon to know anatomy, and this is unique opportunity in our lab to learn the anatomy in association with prosthetic urology, because we prepared the specimens which describe the anatomical landmarks for the implantation, or which can help us to understand the mechanism of damaging or mechanisms of injury or complications. So, and I think it's very important for both young urologists who are on the way to start their own practice, even for experienced one, because I always learn something new, even doing the same things each year during these courses. I always learn something from our senior mentor, Professor Wilson. Dr. Wilson made more than 15,000, maybe 20,000 implants in his life, because as we discussed today during the surgery, there are very small things, how to put the stitch, but it's so important because the rules in the surgery are written with blood. And that is why I think it's very important for all doctors to go back to the roots, to learn anatomy, and it will be really helpful in the daily clinical practice.
I heard that there's your cadaver lab every year. The cadaver is prepared as something different.
Yes, so there are a lot of possibilities in the modern anatomy, how to preserve the corporal tissue and bodies. Or we call it not cadaver, we call it body donor. Why? Because the people donated their own body.
Understood.
In a volunteer way to help us medical doctors to learn anatomy and students. So it's a donation program in Germany, and it's a great privilege. And as I said, there are a traditional way to fixate this body using formalin or formaldehyde, and using this secret fixation of the bodies, which is invented in Kiel by Professor Wedel. We don't have any smell, and during the surgery on these cadavers, body donors, you feel like being or operating on the real patient. So it's very similar to the real condition in the OR.
Why do you think this is important for the surgeons and for the trainees? Were you able to see the differences after the courses, or were there any responses or remarks from the surgeons who trained?
Well, because if you're in a routine situation in your hospital and you want to start penile implant surgery, and maybe did 5 cases in your life and thinking to do more, you would have problems to identify, to make the anatomy of the penis or of the surgical site clear for you. And it really helps to come back to the anatomic basics, to the roots, to understand the anatomy, the normal anatomy of a human in that area, to make the surgery. And important factor, I think, which I wanted to tell you, the speciality of the Kiel is we have the chair of the anatomy, the director of the Anatomical Institute, Professor Wedel. He was a surgeon, so he see the anatomy with the eyes of the surgeon, and he knows what is important, he knows what complications are, and he has so much passion and he loves what he is doing that is another factor which is important, because if you have everything but don't want to do it and do it is because you have to do it, it will not work. And he is very patient surgeon and anatomist, and this combination makes Kiel different in this laboratory spatial.
It looks like, it has been a long way, right? Because it's different from the other anatomical, body donor, studies or body donor settings. You and Dr. Wedel had to create something out of nothing, or you have to create something new, which is a different thing. And usually when you try to do that, there comes a lot of difficulties. Was it right?
It was not easy to organize these courses. First, because of finance, we are academic, and we have no budget for that reason. And what we did, I asked him, he didn't want to do it actually in the beginning, and I asked him, please let me do some preparations, because I want to learn penile anatomy better. Oh. I'm a surgeon, and that's, I think, what could help me to catch his heart, because he said, really, you want to learn? Then, I can give you a key, and you have only possibility to work in the evening. I said, perfect, I will do it in the night. In some years, I was working even on Eastern holidays, and I was amazed from the quality of bodies. It was, for me, like visiting a rock star concert. And then we developed the strategy, I developed actually the strategy to win Dr. Wedel, Professor Wedel, and he was agree after that with me that it could be interesting for, not only for me as an implanter, but other implanters and doctors to learn more about penile anatomy. So, and we created the first course, which was together with live surgery. So we did 1 day live surgery and a second day anatomy. And then our students or participants ask us to spend more time for hands-on and less live surgery, because you can watch the videos on VGPU and other possibilities to watch the live surgery, and we spend more time with anatomy. So that is the reason why we have 2 days anatomy instead of one.
But why? Daniel, why did you want to share? It's that you worked that hard, right? You had to work with, fixing the, body donors and the Easters and some holidays while the others don't. But even so, you decide to share it with the others. Why?
Sean, the question my wife asking me all the time, why are you doing that? Actually, I don't know why. I mean, I love to do that, and I can answer this question. But on the other hand, that's what makes me happy. And if this can help our patients and our doctors to make the surgery less dangerous for the patient, well, maybe this is a reason. Is it reasonable to understand or what I'm doing? I am not sure, but I love to do it.
Do you think that you learn something while you do the training?
While I'm doing the training?
Yeah, like cadaver courses, and now you have a fellow as well.
Yeah.
Having a fellow is a good thing. Sometimes it's not always a good thing, right? You have to train them. You have to spend more time in the OR. But even so, many good surgeons were doing it. Personally, I believe they are doing it not just for the trainee, but for themselves as well. In terms of the surgical skills, or you can learn something from. I was able to learn something from the trainee every time. Was it same to you?
Yes, I learned. Of course, I learned something new during each case. So after each case, I knew a little bit more about the human, about the anatomy, and of course, if you have trainee or fellow from the other medical school or other style, surgical style, it is interesting, because I'm traveling around the world in many countries, and it is different to see how they work, how the organization, and different ways of disinfection and how to prepare the instruments. So all the things are very important for me, because I can maybe see their mistakes, maybe to understand something which is working not good in the hospital, in my own hospital, to improve it. And I think I learned a lot of things from the trainees.